Hi there. Hey, I'm Jen Rice, and you saw by my title, what the heck is the elimination diet? Well, I know we've talked about this before, and I've done some other videos in the past, but the topic was recently brought up again. A friend of mine, Kim, she messaged me about some health struggles. You know, she wants to lose 15 to 20 pounds. She's done the ketogenic diet, but she recently went to her doctor and they found that she had higher cholesterol. So the problem with keto is it's a higher fat diet. She's also been diagnosed with osteoarthritis, so there's some inflammation there. So she was asking me, what was your elimination diet? What did that look like? What's going on with that? So I thought this would be great to bring up again. So thank you guys for jumping on. And I just want to back up and before I share exactly what the elimination diet is, and like I say, the name itself sounds like you're going to go with a lack, but stick with me because I've been doing this eating plan for about 19 months. Originally, it was designed to do for 3 weeks, and I've sort of carried on many components to it, just ongoing, and I feel better. My blood pressure is lower than it's been in years. I don't take any medications. I used to take 2 prescription medications, and I don't take any prescription medications anymore. I'm getting ready to go get my lab work, so we'll see how that's all panned out. But overall, I'm just feeling great. I went from about almost 170 pounds to 144 pounds, roughly, I'm at today. And so it's not that it's not a weight loss plan, though, although I think it's a side effect. You're going to have the side effect of weight loss. And so basically, I was having horrible heartburn, like this heartburn that keeps you up at night. You got to go sit on the couch. I spent like 2-3 hours a night on the couch. I was taking prescription medicine. I was taking over-the-counter medications. It just wouldn't let up. And after, I don't know, maybe I was taking the prescription medications maybe 2 months, I ended up in the ER twice. This was in June of summer before last. So I went to the ER twice in 1 month. I never visit the emergency room, and it was a real wake-up call to me. I was having an allergic reaction to the medication I was taking. Now, how was I going to get over this heartburn if I couldn't take my darn medication, right? So it left me in this position of I couldn't take my medication. I'm a conventionally trained PA, so I believe in medication. I knew that there could be lifestyle changes. I mean, I haven't been living in a closet somewhere as far as totally shut off to using other treatment modalities, but I just wasn't really open to it until I was. And so I was faced with either going to a GI doctor, an allergy specialist to get tested, which there's nothing wrong with those 2 specialties. This is not a video about don't do these specialties, but the problem is there's a lot of testing there, and I know being inside the medical profession that a lot of times we don't get answers for people. We get maybe false negatives, false positives, more prescription drugs. So I went to a functional medicine doctor, and it was there that she introduced me to the elimination diet. And the whole idea behind doing an elimination diet is because you're feeling unwell, and it's going to pinpoint the underlying cause of what's maybe leading to some of your symptoms. So let's say you have heartburn like I did, or maybe you have joint pain, maybe you have allergies, maybe you get hives or rashes often, maybe you have some skin issues that just don't seem to go away despite all your best efforts, and maybe using some of the best stuff there is, right? Migraine headaches, irritable bowel, constipation, diarrhea, gas, bloating, unexplained weight gain. That is a huge thing. I see patients all the time that say, I'm gaining all this weight, I don't know what it's from. So if all your other lab work checks out great at your primary office and they don't really find anything what I'd call a normal diagnosis that a lot of people will uncover, like a thyroid issue or maybe even cholesterol or arthritis, if they're not coming up with anything, it may be inflammation in general, right? So what the elimination diet does is it's going to remove the foods that are causing an immune response within you. And now, Stick with me here, because a food allergy is not the same as a food sensitivity, and a lot of times we get this, we get this mixed up. So food sensitivity is not a food allergy. So when you actually have a food allergy, people will have maybe rash around the lips. They can even get swelling of the lips, swelling of the throat. We know that there's some significant allergies like peanut allergies and seafood allergies and all these kind of things. Food sensitivity is different. It causes these other sort of sneaky symptoms, I like to call them. So it's going to remove them one at a time. And the main things it removes are, like wheat, dairy, eggs, soy, alcohol. I know, I didn't want to give up my alcohol for sure. Caffeine, corn, citrus, and dairy and gluten are pretty much the two biggest ones that people will remove. And some people will do it for 2 weeks. Some will do it for more like 9 weeks. It just kind of depends. It depends on how you're feeling. It depends on, if you start feeling better like I did. I felt so good after 1 week of doing this that I continued. I mean, I'm on month 19 of eating more elimination wise. It's not that I don't eat a variety of foods. I'm just a little bit more picky about what I'll tolerate in my diet anymore. So I see you guys jumping on. Thanks for being here. So I'm talking about the elimination diet. And basically what we're doing with it is we're calming the immune system down. So calming the immune system down for 2 to 3 weeks so we can see who may be in there that's causing issues. And so then you're adding back things one at a time. So maybe let's say you cut out all the foods I mentioned above and you bring back dairy for 2 days. Well, if you have gas and bloating, maybe you get a headache, maybe you're starting to get some mood swings or hot flashes, then you can kind of say that dairy is a sensitivity for you. So as you're bringing it back, you may start to experience these old symptoms, and that's the whole point of it. And I personally did notice that there were certain grains that cause this for me. It doesn't mean I don't eat them. It's just if I eat them, I know that a few days, it's going to be a few days before everything's right again. And there's plenty of great things to eat. If you're interested in learning more about the elimination diet, I have a handout from, there are 2 functional medicine educational platforms that train physicians, PAs, doctors, naturopaths to learn these kind of plans. And so the elimination diet is really well known in the functional medicine community. I'm happy to send you, if you're interested, you can private message me. I can send you that menu. It has a shopping list. I did 3 14-day challenges last year with great groups of people that got some really good things out of it, and some of them are still following the principles today. I also often will talk with people kind of one-on-one about what they're looking for in their health, and so just private message me if you have certain questions. But you got to invest a little bit of energy and time into anything that you want to have happen, and I know that Kim feels this way too. So we're starting with something like the elimination diet. See what's on there, see how you can do with it. I mean, it loses some people probably with the name alone, and then secondly, giving up alcohol for 2 or 3 weeks can be like, oh. But honestly, I think I went almost a year without drinking alcohol, which, for this Irish gal is quite a feat. But I feel so much better that, it's sort of like that saying where they say, you have to have the pain point that's strong enough to like propel you forward. So it just kind of depends on where you are with your health. But I would encourage you, if you're struggling a bit, feeling a bit unwell, you've been to the doctors, you're not, you're maybe on some medication, maybe you're not, but you're just not feeling great, this could be a great option for you. So again, feel free to reach out to me. If you think this video could help someone, please consider sharing it. I think that this is an easy thing to see if 2 to 3 weeks of your life can change some things for you. So I hope you guys have a great weekend, and thanks for being here.